Hello, everybody. My name is Professor Juan Valle from the University of Manchester and the Christie NHS Foundation Trust in Manchester, UK. It's my pleasure to be presenting a summary of the results of the TOPAZ-1 clinical study in this presentation. Let's start off with a little bit of background. Biliary tract cancer, which we're all familiar with today, is a difficult to treat cancer. We know that the majority of patients unfortunately present with advanced disease, and for those patients, the outcomes have been poor and the treatment options are somewhat limited. And that means that we have often been associated with patients having a short survival, and there's been a very clear need for some new treatment options to be developed. At the moment, if patients are diagnosed with this type of cancer, the first line standard of care is chemotherapy. And we use chemotherapy with a combination of two different drugs called gemcitabine and cisplatin. And this has remained the standard over the last 10 years following the results of the ABC02 study. If at some point the cancer does get worse, additional chemotherapy can control the disease in some patients, but there are few effective treatment options, and so we're always looking to expand and see if we can get some new therapies to be able to use in patients. Many patients will have heard of immunotherapy, and durvalumab is a type of immunotherapy that may work in patients with advanced biliary tract cancer when given in combination with chemotherapy. And the idea is that it helps the body's immune system to recognize and kill the cancer cells. The purpose of this trial, called the TOPAZ-1 study, was to find out if durvalumab, in combination with chemotherapy, was able to help patients with advanced biliary tract cancer live longer than treatment with chemotherapy alone. Now, the title of the study is rather complicated, so I'll take you through it and break it down. The TOPAZ-1 study is a randomized, double-blind, global phase 3 clinical trial of durvalumab in combination with gemcitabine platin chemotherapy, or GemCis, for the treatment of patients with advanced biliary tract cancer. I just take you through that. It's a randomized study. Now that means that the treatment allocation was made completely at random, usually by a computer, but similar to tossing a coin. Double-blind means that the patient or the treating doctor didn't know whether the patients were receiving the durvalumab or indeed a placebo, a dummy drug, which was given in the form of a drip at the same time. A global study speaks for itself, and just to highlight, it was an international study, and phase 3 means that the study is in the late phases of development, where we are comparing the standard of care with the new treatment, which is the standard of care plus the durvalumab immunotherapy. So I hope the title now makes a bit more sense. Let's talk about the methods. So the TOPAZ-1 study included patients from all over the world who had biliary tract cancer that wasn't suitable for curative surgery, or if people had undergone curative surgery and maybe chemotherapy afterwards, the cancer had then recurred 6 months or more after the completion of curative therapy. So in summary, this was really for patients who needed to have their first treatment for advanced disease. I think it's important to say that all patients received chemotherapy with gemcitabine and cisplatin. So it wasn't that patients were not receiving treatment, everybody received the chemotherapy. In addition, patients in the study were then randomly assigned to either receive the immunotherapy, called durvalumab, this was given intravenously, or given a placebo, which is a matching drip, but did not contain any active drug, alongside the chemotherapy. And as I said, patients and their doctors did not know which treatment they were receiving. It was double-blind. The primary purpose of the study was to assess the reduction in the risk of death for patients who received durvalumab and chemotherapy compared to those who received placebo and chemotherapy. In other words, did patients live longer if they received the immunotherapy in combination with chemotherapy? Other outcomes that were assessed in the study included the length of time that patients remained alive without their cancer growing or spreading, the proportion of patients who had the tumor shrink or disappear, the safety of the treatment measured in side effects, and the change in quality of life for patients in both treatment groups. So, what are the results? What did the study find? The results of the study showed that patients who received durvalumab and chemotherapy had a 20% chance less of dying compared with patients who received placebo and chemotherapy. On average, patients who received durvalumab and chemotherapy survived for at least 12.8 months after starting treatment, while patients who received placebo and chemotherapy survived for at least 11.5 months. Now, this average may not seem very different. This is an extra 1.3 months. But if you look at the percentage of patients who were still alive, for example, after 2 years, this was only 10% of patients who were receiving placebo, compared to nearly a quarter of patients, in fact 24.9%, who received durvalumab and chemotherapy. More patients who received durvalumab and chemotherapy also had their tumor shrink or disappear after treatment compared to those patients who received placebo and chemotherapy. But what about side effects? Well, the safety assessments showed that a similar proportion of patients experienced side effects that were caused by the treatment in each treatment group. In other words, the immunotherapy didn't seem to add a whole lot of extra side effects over what you would normally expect with the chemotherapy. In addition, a similar proportion of patients stopped treatment in each group due to side effects from treatment, and there was a very small number of deaths due to side effects caused by the treatment in both treatment groups in the study. What were the conclusions of the study? Well, overall, the TOPAZ-1 study met its primary purpose and was able to show that patients with advanced biliary tract cancer who received durvalumab and chemotherapy treatment did live longer than patients who received chemotherapy alone. In addition, using durvalumab in addition to chemotherapy didn't make the side effects caused by the chemotherapy any worse. And this study also showed that the combination of durvalumab and chemotherapy may provide a well-tolerated new treatment option for patients newly diagnosed with advanced biliary tract cancer to help them live longer. I do need to tell you that durvalumab is not yet licensed for this type of cancer, so it is not available in the UK and Europe. It still needs to be approved by the regulatory authorities, hopefully in the near future. Please take a look at the information in the poster and feel free to ask if you have any questions. And thank you for taking the time to listen to this presentation. Have a good day.